There's a box for Black, Latino, White, Asian. For Arab Americans, there is no box.
Yeah, and Illinois has the 5th largest Arab population in the country, and yet they are not counted.
CBS 2 investigator Dorothy Tucker takes a look at the impact of not being counted, especially during COVID.
She didn't leave us. We miss her.
Aisha Abu Layla, born in Palestine, 1938. She died alone in a hospital in Palos Heights, June 2020, from COVID.
And we couldn't say bye to her, and we didn't see her.
While the pain of losing her mom was unbearable, Awa Abu Layla counts her blessing the family didn't have more casualties from COVID.
My daughter, my son, my brother, my sister-in-law, my sister, her kids, her family, her husband, all of them got that.
All of them got
all
COVID?
of them. They got it, but in different time.
If we were writing this story about any other community, we'd be able to tell you the dozen or so family members Abu Layla rattled off are a fraction of the larger number of Arab Americans who contracted COVID. But we don't know the numbers. No one has any numbers. How many Arab Americans have died from COVID?
I don't have a number for you. I don't. That is the battle that it is ongoing in our community.
It's a battle to be recognized like other communities. Blacks, Latinos, Asians, Native Americans, and whites are counted by the city, county, and state. But for Arabs, nothing. On paper, they don't exist.
We are labeled as white.
Are you white?
Not treated as white. Nope. We are not white.
There are so many reasons Arab Americans like Itidel Shalabi argue they shouldn't have to check the white box, especially when it comes to COVID.
Allahu Akbar, Allahu Akbar.
Compared to whites, Arabs have a higher risk of diabetes and obesity. They're more likely to live in poverty, be essential workers.
That means that Arab American populations are continuing to go through this pandemic, perhaps at an increased risk.
It's personal for Nadia Abwel Azam. She's Arab and an epidemiologist who studies Arab communities.
It's upsetting. I mean, I've dedicated my career to better understanding the needs of Arab Americans, and there's hurdle after hurdle.
Even the place that records the cause, race, and ethnicity of every death does not include a category for Arabs. Looking at the medical examiner's report, you would think no Arabs died from COVID in Cook County, but we know they did.
My uncle's name is Abdul Karim Hedge.
His birthplace?
It's like a small village in the West Bank.
His place of death? Oak Lawn.
Whenever he can interject, I'm Palestinian.
But we checked the medical examiner's data. Hodges' race listed as Asian. He wasn't.
It's disturbing because it's almost like it becomes a lie in a way.
Disturbing also describes Abu Layla's feelings. Remember, her mom, Aisha, died of COVID in June. Under race, the ME's office lists her as other.
I feel like we're not noticed, or like we feel like we're left behind. And we are a big community right now. It's a huge numbers of Arab Muslims here.
Little Palestine.
We got this one, which is from my country.
And is what some call the thriving suburb of Bridgeview, but Arabs in communities like this one often feel ignored.
We are the invisible community.
Being invisible is a problem.
We are not on the radar of many institutions, funders, and that impacts us as a community.
That was never more evident than when the pandemic hit. The data showed blacks were dying at a disproportionate rate.
Those numbers take your breath away.
That data dictated the money and resources. But since the Arab community wasn't counted, it got little funding.
Do you think you lost lives? I think the COVID testing not being early on has caused a lot of deaths in the community that could have been prevented, absolutely.
And when it came to vaccines, how much money did you get for vaccine education?
For the vaccine, zero.
So they've spent their own money.
We're rooted in the community.
And donated their time. People in the community are lining up for the life-saving shot. But again, there's no record on how many have taken the shot and how many more need it.
So here's the question, why?
Why are these health agencies not collecting COVID data on Arabs? No one seemed to be thinking about that question until we started asking. The response we eventually got from the governor's office? We're working on it. But in Michigan, they're already doing it.
Now there's an Arab category
on all COVID vaccine forms, so the community here is counted. And with the second highest Arab population in the country, there was pressure to collect the data.
Having the data, to back up the words that we're saying and the push in people to get vaccinated, it makes a big difference.
Right-handed? That's the kind of impact community leaders want to see in Illinois. And it starts with state officials.
Our own states have their own power to create a category for Arab Americans.
Advocates would like an Arab designation in all forms, hospitals, schools, jobs, but having a category for COVID is at the top of the list.
Could have saved lives. It could have saved lives in our community as well.
I will be very happy to see it will make a huge difference for us.
Dorothy Tucker, CBS 2 Investigators.
Fascinating. Arab American Family Services says as of earlier this week, they finally received funding for vaccine education. The governor's office told us an Arab designation to the COVID vaccine data forms will also be added in the next few weeks. Illinois is changing the way it collects data on vaccinations, all because of a CBS 2 investigation, one that revealed COVID cases in one of our largest communities of color weren't getting counted. CBS 2 investigator Dorothy Tucker reveals how the change will help the state fight the pandemic.
Are you vaccinated?
I am vaccinated.
As co-founder of a community organization, the Arab American Family Services, Aitidel Shalabi got the vaccine early in January. When it came to race, what did you check?
White.
Are you white?
I am not white.
So why did you check white?
And that was the only choice I had.
What's that like, not to have that box?
It hurts.
Nira Mintaha is also a co-founder of the organization.
It's frustrating. It tells you that you don't exist.
That frustration was the crux of a CBS 2 investigation in May, when we first broke the story of how a community of nearly 150,000 people in Illinois was among the hardest hit by COVID-19, yet the deaths were not being tracked by the city, county, or state.
I wish she's here. I wish she didn't leave us. We miss her.
We discovered our Abu Layla's mom was listed as other on the Cook County Medical Examiner's report and showed where every other race is counted, but there is no box for Arabs.
I feel like we're not noticed, or we feel like we're left behind.
And when the life-saving vaccine was rolling out, Arabs still weren't being counted. That just made it harder to convince some in the community to get the vaccine, that it was critical to saving lives.
This matters to us. This being counted and being part of the larger community is important.
So we wanted to know why Arabs weren't being counted, and more importantly, would state officials finally make a change? The push for answers started with this email on April 21st, sent to the state, asking that very question, why? The immediate response from the governor's office, we're working on it. 8 days later, we're told the MENA category, Middle Eastern North African, has now been added. Only when we checked the state's dashboard, used by the public to track vaccine distribution, it wasn't there. We kept checking all of May, most of June, nothing. On June 28th, the governor had a press conference.
Are you going to keep your promise to the Arab American community to add that designation?
Well, I certainly will talk to IDPH. I don't know where that is in process, but we'll make sure to get back to you about it.
They did. This is what the community was waiting on.
Oh, the Middle Eastern North Africa. Woo! Sorry, I had to see it with my eyes. I was like, yes, yeah. Congratulations.
Finally, a box for those who identify as Middle Eastern or North African. MENA.
Just seeing this is absolutely wonderful.
Keep in mind the state health department had been collecting vaccination data for months, adding up to millions.
And then you're looking at over 7 million.
But Arabs weren't added to the mix until late April.
I don't see our lime green in the chart.
So compared to other groups,
white 7.7.
So how many people put Asian too?
The numbers of Arabs vaccinated was low.
Very low.
Absolutely,
And we
yeah.
know that they're not accurate.
Right.
Because we know, as Nariman said, we did more than that in our office alone. We did more than that in registering people. But we had to put white because it wasn't there previous.
Right. Still,
it's a stepping stone.
Yeah.
It's the first step to many more steps of being counted and visible and recognized as a community.
the goal now to educate the community about the new box and be counted as Arab Americans for the first time in Illinois history.
We are visible now. We exist.
Community leaders want to see a box for Arabs in all forms, from education to hospitals to law enforcement. That will require a new law. So now, that's what they're working on. Dorothy Tucker, CBS 2 Investigators.